continue for 1 minute 45 seconds.
We get oxygen, please.
This man's heart stops as a result of a heart attack, requiring CPR and a shock. In this Bondi Beach rescue video, the heart stopping as a result of a heart attack is in contrast with the previous video when the heart stops as a result of hypoxia due to drowning, and the management approach is slightly different. Let's get into it.
Buddy. So what, you just started feeling a bit off in the water and swam in?
Yeah, I was feeling fine on the first lap, and then I started coming back and I went, oh shit, what's going on?
So you've never had this problem before? And is it getting any worse?
This feels shit.
His name was Kurt. He was 54 years old and he was complaining of chest pain.
Rhino to Bondi Central. Can you call an ambulance for us? We've got a guy down here having a possible heart attack.
His arms had a bit of pain and he had pins and needles in his hands, so start ringing alarm bells.
In this 35-second segment, you're getting the classical features of someone that's having a heart attack. First, you have an older person, typically someone that's above 50 years old. This person has had years to deposit cholesterol and other damaging materials into the blood vessels that supply the heart, which is why it is rarer to have someone that's younger to have a classic heart attack. Next, he's describing classical symptoms of having a heart attack. First, he describes feeling sick or nauseous. Second, he describes having chest pain and an altered sensation down his arm. Typically, this is chest pain that radiates up the left neck and down the left arm. In this video, it is described as pins and needles. The last symptom, which is demonstrated a bit later in the video, is autonomic symptoms. This is the patient feeling grey, clammy and sweaty, and I'll point it out later in the video.
Ambulance, please.
We've got the defib whip. Yeah, mate, bring it down.
Hey, Whip, can I just have those stats again? Who is he, what age?
Have we got an age?
54.
Yeah, whip it to Nicola. It's slowly getting worse, so just tell the ambo to be ASAP.
Yep, Ambo's on the way, boys.
In this case, they are absolutely right that he needs a defib, and they need to put it on as soon as possible. In the cases of a heart attack, the heart will normally deteriorate into a catastrophic rhythm called ventricular tachycardia or ventricular fibrillation. And these rhythms are shockable rhythms. And you need to shock or defibrillate the patient as soon as possible, as the longer you wait to give the shock, the harder it can be to shock them out of this dangerous rhythm.
Slowly get you onto your back. And all we're going to do is apply the defib machine. Does that feel there worse? And then do is put it, chuck it on.
We're actually trained not to put the pads on straight away, but all the signs and symptoms were there. You know, it was a really big chance that he was possibly going to have an arrest.
You feeling a bit better?
All I can really do is just keep him comfortable. Really hoping that ambulance will be coming down.
Have you got anyone you'd like to get us to contact at all?
I knew I had to make that phone call because if my husband was having a heart attack on the water's edge at Bondi, I'd want to know.
Pads are applied early, and this is excellent. If this was a hospital defibrillator that has a screen that displays the heart electrical activity, you would see dangerous changes to the heart electrical rhythm, including ST elevation, ST depression, left bundle branch block, including other changes. In this particular frame, you can see how grey and clammy he is compared to the rest of his body, highlighting one of the classic autonomic signs that you'll get when the patient has a heart attack.
The ambulance has arrived now, so hopefully we can get him to hospital pretty quick.
Oh God, I'm starting to go out.
Pardon?
Where's that? I'm starting to faint.
Faint?
Was he breathing
Open
really
your
quick,
eyes.
guys, before? Was he breathing?
Gone now.
We witnessed
At this point, he starts to faint as not enough blood is getting to the brain. This happens because the heart muscles are continuously damaged by the ongoing heart attack. The damaged heart muscle is weak and therefore does not pump blood well. And the damaged muscle also causes the heart to go into a dangerous rhythm, either ventricular fibrillation or ventricular tachycardia. These rhythms are dangerous because it does not allow the heart to pump blood in a coordinated fashion. The combination of a weakened heart muscle as well as a dangerous heart rhythm results in an ineffective flow of blood forward. Less blood pumping forward leads to less blood flow, leads to a lower blood pressure, and therefore not enough blood getting to the brain, and therefore this patient starts to lose consciousness. This is obviously a medical emergency, and if you encounter a patient like this in hospital, the emergency buzzer must be pulled.
the arrest, and I was just like, oh shit.
If he stopped breathing and his heart stopped pumping, he's in cardiac arrest.
Call for help. Analyzing heart rhythm. Do not touch the patient. Get that on for me.
Yeah, come on.
He just passed out then.
Yeah.
His hands are going.
Wait, analyse.
Shock advised. Charging.
The red button.
Red button. Everyone clear? Press shock 1 delivered. It is safe to touch the patient. All right. Someone begin CPR now.
Someone get on the chest. Someone get on the chest.
Go.
As this video has already gone past 5 minutes, I'll post the rest of this CPR breakdown video on my channel next week. Please follow and stay tuned for more. I hope that helps.